joined now by Professor Linda Gail Bekker. You'll remember her more recently, perhaps, from the work that you do with the Sisonke J&J trial for the COVID vaccine. But you are, of course, also the CEO of the Desmond Tutu Health Foundation. Talk to me about the beginning of that, which was begun as an HIV foundation.
Yeah, so we go way back to about 96 when we had a cohort of people living with HIV. We were ensconced in the New Somerset hospitals. Such was the stigmatization of that disease. And so people really were receiving palliation at best. Towards the end of the 90s, people will know that we had antiretroviral treatment, but it was incredibly expensive, inaccessible to us here. And so people were dying in this country in droves, yet there was life-saving treatment, but so expensive it actually wasn't available. In addition, we will remember those were the dark days of AIDS denialism, and our own, administration here was not trying very hard to get antiretroviral therapy because there was a belief that HIV was not the cause of AIDS. And so there were many reasons why we needed a strong voice in the campaign, not only to change the thinking of the government of the day, but also to be an advocate for global equity and social justice. And who better than the Archbishop Tutu? And so he absolutely enthusiastically agreed that he would be patron of the Desmond Tutu HIV Center, and has been since August of 2004, and really has been the most wonderful, hands-on, committed patron that anybody could ask for.
Yeah, because as you explain, there wasn't the political will under the government of Thabo Mbeki to roll out this life-saving medicine. And now, of course, today HIV can be managed as a chronic disease because of this medication. And it's so interesting the role that Archbishop Tutu played. I would imagine, and also once there's a treatment, that helps remove some of the stigma as well.
Absolutely, and so he, well, again, typical of who he was, not only was he outraged by the inequity and the social injustice that people were denied treatment, but he was also outraged by the political ideology of the day. So both of those were very important, but even more important was his mission of, or his message of inclusivity. No one should be left behind. And he described HIV as it was in those days as the new apartheid. He recognized that people were ostracized simply because they had become infected with the pathogen. And all of us today, knowing how easy it is to be infected with COVID-19, he was incredibly empathic and recognized that no one should, receive less simply because they'd had the misfortune of becoming infected with an organism. And that love and compassion, I think, again, just made such a difference in terms of people feeling like they could come to terms with the infection and live with it. And indeed, now today we have almost 8 million people in this country who do have to face living with the virus for the rest of their lives. But I believe that people like the Archbishop has made it easier for many.
And he was a great proponent of education and understood science. And I'm thinking particularly of what we've gone through in the last 2 years with COVID. Initially, they were COVID deniers, very similar to what we saw around AIDS denialism. Even in the face of evidence the vaccines help prevent people going to hospital and dying, we still see people doubting that they work and that they are safe. You have been working with the Sisonke project, and I wonder what the latest is on that. Where are things going?
Yeah, well, maybe I'll just first sort of hint at the approach the Archbishop took in the face of that hesitancy or that skepticism was one of compassion, recognizing that individuals had to be brought along, and perhaps that's a lesson we can also take forward into the new era. But yes, today we had some good news. We've been looking at the boost doses of J&J in our healthcare worker cohort known as Sisonke. And today we have a preprint out showing that there was an 85% reduction in hospitalization in people who received the booster dose. And this is in the face of the famous Omicron variant, which of course made us all very anxious. But the good news is that indeed the vaccines are holding up, even in the face of variants. And I hope that that too will encourage people to, if they haven't yet done so, to think about being vaccinated or boosted.
And let's not forget that the Archbishop, while very frail in his later years, he publicly had his vaccination.
Yes, he was a man who walked the walk, talked the talk. He was truly a role model in every sense of the word. And he taught us to never do unto others what we would not want others to do to ourselves. But he also was willing to say, I'm willing to do what I'm asking others to do. And, I think that right till the very last, as you say, despite being extraordinarily frail, publicly stood in a line and received his vaccination, as I hope all South Africans will follow suit.
You explained how his name, when he lent it to your organization, really helped to challenge some of the stigma around HIV and AIDS. Going forward, you will continue to carry his name. What do you see as the legacy that you must live out now that he has left us?
I think without doubt, the one that I carry, and we've heard it wonderfully many times this week, reminded of it, is the Ubuntu, compassion, inclusivity, tolerance message. And, it reminds each person in my organization, and indeed I think in the healthcare sector altogether, is that every single individual deserves the best possible care and health and well-being that we can provide, and no one should be left behind. And of course the Arch really believed that in terms of the most marginalized, the people who bear double stigma. Maybe they live with HIV and they love individuals of the same sex, or they are sex workers, or they are people who inject drugs, people who are particularly vulnerable for HIV, tuberculosis, but so often are left on the margins of society. And he reminded us that those individuals matter even more. And that is what my organization will continue to take forward and really, preach wherever we can.
We are hoping that we look back at HIV/AIDS and we forget the horror of how many people were dying without treatment. It was horrific. And if we look back at particularly the last year with COVID and the horror of so many people dying, and now hope with the vaccines, and also that the Omicron variant is not going to be as deadly as other variants, do you think that we're perhaps seeing the end of COVID?
The one thing I've learned about this particular epidemic is not to stare into a crystal ball, because, I think it's really very hard to predict. I do hope that, the situation we found ourselves in 20 months ago in February, or January of 2 years ago, when we were all completely naive to the virus. Our immune systems were really, if you like babes. Things are much better now, in as much as we have made some headway with vaccination, and many of us, unfortunately, have been infected and survived happily. Many of us have, of course, lost loved ones, friends, and others. But that definitely puts us, I think, in a stronger position going forward. Obviously, the virus may mutate more, and I think we should expect that to happen. It is what viruses do. But hopefully, we've learned many lessons, and so I do think it's likely that, we'll be in a better position going forward. I hope it is the end. Whether other epidemics may occur, of course, is always a very real possibility. And so I hope most of all we remember the lessons we've learned from the experience of the last 20 months and apply them going forward.
All right, well, thank you so much for sharing your memories of Archbishop Tutu and also giving us the good news about the Sisonke trial, that it is vaccine is proving even more effective against the variants and COVID as a whole. Thank you very much for your time. That, of course, is Professor Linda Gail Bekker. She's co-chair of the Sisonke trial, but also, of course, she's the CEO of the Desmond Tutu Health Foundation.